and welcome to our discussion here on Ethics in Depth. My name is Sean Haverson, paramedic and faculty member here at Central New Mexico Community College. We're going to talk about ethics here, just a little bit more depth than you have in your textbook. I think 2 pages worth of information, if that is really insufficient to prepare a paramedic to make the array of ethical decisions they're going to be making without a lot of resources other than the tools that they have from lectures like this. So let's get started. We have a couple objectives here that we need to meet. The DOT does require that we cover a complex depth and breadth of knowledge for ethical principles, and those should enable you to make decisions in the ethical world. The ethics list that we have below here for objectives helps identify some of the Department of Transportation objectives that we have to cover in this lecture and in future lectures. On the second slide here, we have a few more objectives, and these objectives really will underscore a little bit further of the concepts that I need you to understand so that you can actually reach that overall goal from the Department of Transportation. Okay, let's get started. So ethics is a philosophical branch of study, and in that branch of study, the question is always, whether it's a sub-branch or the actual overall ethical branch of study, is what is the human thought process on right and wrong? So what things are right, what things are wrong, and how do we say that things are right and wrong? Also, are things right and wrong always or only in certain conditions? And so that array of questions really brings us to the biomedical ethics that we'll cover today and you'll be concerned with for the rest of your career. Biomedical ethics just is a sub-branch of philosophy for ethics, and what it's discussing is anything that has to do with cells, anything that's living. So not only animal research, but also research that involves biotechnology, the practice of medicine, and medications, and research dilemmas. So this central question is not in your book, but I highlight it because it's very important for us to understand what the central question of biomedical ethics really is. So from Beauchamp and Childress, we have, which general moral norms for the guidance and evaluation of conduct should we accept, and why? So let's talk about why ethics. The first thing I want to highlight before we even get into the history of ethics and some of the concepts you'll need to know is that there are bodies of literature, GEMS, the pre-hospital emergency medicine annals, some of the other documentation that we have articles within them that are highlighting that ethics in EMS seems to be declining faster than we can bring it back up. And so if you ask me my theory, I think one of the components of having poor ethics in EMS is that we're not teaching ethics well enough in our classes and in continuing education so that folks can revisit it and build their toolbox as they go along. Other things are probably a little bit societal. So in the ethics in EMS, Winnie Majori here, which is New Mexico's own, she's a paramedic and a practicing attorney, and she works to defend and help prosecute anybody that works in the medical field and first responders, including police and EMS. And what her version of this article really is highlighting is that there are a lot of cases she's seeing that show basically moral turpitude. And moral turpitude is basically the ability to make poor decisions when you should be making good decisions, like sexual assault on patients and drunk driving and theft from patients, as we've seen in Santa Fe more recently. So with that in mind, let's go ahead and start a bit expanded view of ethics. Ethics starts with really Socratic thought. And although there were some ethical considerations, Socrates was really the first person that we know of, at least, that was digging deep into the thought process of what it means to be ethical. And for him, he was focused on something called virtue ethics and trying to find virtues of living beings that made them ethical. Or what virtues do we strive to make sure we have so that we can make ethical decisions? And so the interesting thing about Socrates is he actually utilized a different type of teaching. Rather than writing things down like most of the folks around him were doing, he spoke just directly to audiences or face-to-face to folks and used inquisition, the Socratic questioning method, in which he asks people questions so that they can explore concepts further and further in depth than they would have just by attending a lecture per se. But we do have his thoughts listed because primarily his 2 students, Plato and Xenophon, wrote down all of his teachings and published them later on, and there was a revival during the middle ages on some of this documentation as it was found and explored. So one of the things that he's highlighted here is that foundational to his virtue ethics, is that the unexamined life to him is not worth living. And that's important because the unexamined life not worth living, quote, used at basically the end of his life, highlights that if you want to be ethical, you have to dig deep into yourself and explore yourself to figure out what it is about you that are ethical virtues, right? The virtues of being and virtues of making good decisions and in general being good, being good. So we want to highlight that because that's really something you have to do throughout your practice. You have to examine your ethical thought process, because what you're going to do when you see other people is question your own ethics, question their ethics, and see if there's an ethical dilemma that arises, how we're going to meet that with tools that you have just by exploring deeper into your own thoughts on things. In this painting, we have a picture of Socrates at his death. He was living in a state where during the time period at the end of his age, the Athenians came to his town and took over. And when they took over, they essentially required that anybody that lived in that town had to follow their thought process, the Athenian thought process, and also worship Athenian gods. And unfortunately, Socrates taught people, fortunately I think, but not fortunate essentially for him, he taught people to think for themselves and dig deeper into why people tell you to do something and not just accept blindly what somebody says to you. And so he was teaching this as a teacher, as a philosopher, and as a statesman. And finally, the Athenians got a little fed up with it, and they sentenced him to death. And his found guilty and accusation was for the corrupting the minds of the youth and not believing in the gods of the Athenian state. So here he's actually accepting his death. He had many opportunities to escape. He chose not to escape and would take out the death penalty, which for him was to drink poison. And we can see here, this is him right before he drinks poison, and everybody in the room is certainly distraught by what is happening to their friend Socrates. So we should make sure that we're not just doing things basically because people tell us to do things. We have to understand why those things are, and that's the only way we can determine how we work within ethical boundaries when there are gray areas. So let's highlight something your book does talk about, ethics versus morals. In your book, really the terms are qualified as being nearly indistinguishable. I think in common conversations that's probably true, and we'll certainly use that here. It is true to say that an ethical paramedic is a moral paramedic. You really have to have the two same qualities to make that a true statement. So morality is a specific application of ethics in most of the definitions that we have. So I want to kind of highlight this thought process. Is it true that acting legally is to act ethically? Is it true that always acting legally means that you are always acting ethically? Think medicine, think politicians. Oh, once I said that, you already knew that this is actually not necessarily true. Our laws are based upon ethics, whether it's biomedicine or the laws that are part of our world today. And you should note that Socrates' thought process is alive and well in democracy. So they are based on ethics, but sometimes these ethics are construed, right, and kind of mucked up a little bit. So they're a loose equation of moral beliefs. And part of that is because we have big cultures within our United States, as an example, or other parts of the world. Cultures have mixed, and so there are moral beliefs that have mixed in that process. So let's talk a little bit about morality. So certainly your textbook's going to talk about personal and professional ethics, right? Personal and professional ethics. And in personal and professional ethics, you have a set of ethics that apply to your job as a paramedic. They apply to your job as a medical practitioner. They apply to your job as a public safety representative. So you represent the public good when you put on your uniform and your badge. Now, the personal ethics that you have are the ethics that you personally have inside of you based on your individual upbringing on what is right and wrong, right? Right and wrong for you. Now, we have to identify that those things are certainly always going to come into play with our patients, and we have a conflict between the professional and the personal ethics, or you and your patient. So generally, we'll find that you place your ethics aside. But that's a little bit too simple. We have to dig in deeper because should you always place your ethics aside when you're dealing with patients that are acting completely unethical? Well, let's look at morality a little bit further. So we have two different forms here that are identified in common literature when we start digging into bioethics. And so we have common and particular morality. You could call it common and particular ethics. However, we would be digging a little deeper, which requires morality then becomes the term for something that is more pointed than general overall ethical rules. So the closest thing to just a general overall ethical rule will be our common morality. So common morality is going to apply to all persons, all places, and we rightly judge all human conduct by these standards, which means that we probably have laws based upon them and consequences for what happens when we violate them, just as a society. Particular values are really going to be morality that is relative to your culture, the professional practice. So common morality was, all of these things overarching, and then you have different industries within that. So then particular is talking about the ethics of an industry or our personal practice guidelines. And so a lot of the things that come up with this, let's kind of list them, right? So religious beliefs. We also have cultural and personal, at the very least, right? And culture can be many things, right? That could be maybe you come from a Native American society, and that's how you make your frame of reference when you make decisions. Or perhaps this is just simply pop culture. Pop culture actually does have an impact on the way that people think. So it does bring with it some of the particular morality values that we're discussing here. To add another term to the mix, let's talk about values. So I've used that term a few times, and I've actually used it interchangeable so far with beliefs, and that's how you think of it. Values are your personal beliefs, and they're the things that go into building our own right and wrong. In addition to the values that we have, external entities and pressures are going to drive our decision making. Here's an example of two different kind of I guess you could think of classifications of terms and in what area they would fall, whether they're common or particular morality. So right down the center here. So do not kill. Do not kill is actually something that supersedes, although it's written very clearly in the Ten Commandments in Christian and Jewish belief, but do not kill is actually overall in most religions. And so since it's overall, it becomes a common morality. Do not cause pain or suffering to others. Prevent evil or harm from occurring. This is actually requiring you to act, right, when we see something. And rescue persons in danger. Now, your religion might also identify these things, but those are part of the common thought. Let's look at more particular things like obtain a written and oral informed consent on human research subjects. That's because we have professional, so we could write here professional values that identify that those are particular moral beliefs. Report all suspected abuse. This is professional, but also legal. So because we have individual things, whether it's our professional code of conduct or it's a law for EMS, it's then more particular morality. Now here's an interesting one. Thou shalt not commit adultery. Now, it isn't always true in society that thou shalt not commit adultery. However, if you believe in the Ten Commandments and your religion is based on those, then those would be particular morality because they are religious. And then honor physical and judicial laws, which is part of the EMT oath, which we'll expand a little bit later. So these are all particular to a profession, to you, to a religion, or a culture, particular morality. And then we go further, another term for us. So far, let's kind of list what we have, right? We have ethics. We have morality. And with that, we have particular. And we have common. We have values / a belief, right? And now we bring relativism into the mix. So ethical relativism is important because it arises from a view of common moral ethical code, right? So common morality. And then we work in a gray area of ethical relativism. And this is where some of the particular relativisms will be applied to whatever it is that we're dealing with as a dilemma. So moral dilemmas are often ambiguous, meaning that basically they're going to be gray area, the gray area where we exist in. So is there an answer? Perhaps not. So this is going to be the intersection of your values. I'm getting a little crazy with my line drawing here. I swear I've only had iced tea to drink today. This is the intersection of our values, and they don't always translate between your patient and you. So remember that we said that essentially you need to make sure that your patients are coming first, right? So we'll talk about that in a little bit later. But when you engage with your patients, you engage in a relationship with them, right? Now, the relationship may be very temporary, and there's boundaries to the relationship, right? But just in knowing them and acting on their behalf, we identify that they have a relationship with us. So this is not necessarily ethical relativism, but Einstein certainly likes to get relative, huh? And there he goes. Now let's look at the patient-paramedic relationship. And I put patient first here. Now, if you're thinking about perhaps a relationship, you probably have heard of something like the physician-patient. But notice who came first in that, the physician. So we certainly identify that the patients are always first for us. And our relationship does have an imbalance just in general on the scales. And we'll talk about that in just a second. So let's kind of define this. It's a social contract. You engage in a contract with your patient that they will do certain things, and they allow you to do certain things based on the agreement that you come to through consent and the nature of the call. And then they have certain boundaries that they have to respect with you, right? They should treat you correctly. They shouldn't spit on you or throw poop on you, like we might consider some of the things that have happened to EMS folks in the past without obviously much retribution. So with the contract, it requires respect for each other's ethical views, right? So our values have to be respected. Although the customer is always right? They are customers with us. The customer is always right. I would argue that your beliefs cannot always be set aside. Because as we'll see in just a moment, when you make decisions for patients, perhaps when they're unconscious, you make those decisions based on your ethical orientation in life. So it becomes an important factor in our relationship. And we should also say, so on this scale that I have here that's imbalanced, the patient is not as balanced as the paramedic. So the paramedic has more balance, more weight, if you will, than the patient. And that's simply because of authority. When you go to a call, you have authority with that patient and over that patient. And so they look to you and will often let their beliefs come aside to your beliefs. So you have to make sure that you're trying to balance that imbalance, if you will, homeostasis perhaps, because it will impact their psychophysiology. We want to make sure that our authority is not overwhelming them and their decisions. We should leave room for them to make decisions without our pressing down on the scales of decisions here. So you know what? I've been talking for a little while. Why don't we get into a scenario? So here's your scenario. You're dispatched. As it comes over the radio, Rescue 14, respond to US 60 between Willard and Encino for motor vehicle collision rollover. Patient has major bleeding from an arm. So this class and code 29 Delta 2 means it's serious business if you don't know it already, and it basically is going to tie to the rollover part of this MVC. So en route, you have fire department, PD. High winds and sleet have prevented the helicopter from responding. So no helicopter for you. You're the only paramedic on scene, and there's limited radio and cell coverage. Dang it, it's that one spot. Probably the worst spot to get into an accident. And so here we can see it on a map. To drive there in normal conditions would be an hour and a half from the location of the accident, and you can't have anything that's going to fly to you straight as the crow flies. Also on scene, we have with us EMTs and first responders, but you're the only paramedic to make the decisions. So what I'm getting at is you have to make the decision. So here's your size up. The vehicle looked like it's rolled over a few times. It's a mid-size sedan and it's on its roof, so it's upside down. One patient is screaming weakly. Icy roads, wind, nighttime conditions, so generally unpleasant and the wrong place to go. The fire department's arrived with 3 EMT basics and you have law enforcement on scene. The patient's name is Anthony. He's in his 30s and he is actually an acquaintance. On arrival, you find him at the scene and you notice that he's somebody that you recognize in the community, and maybe not in a bad way. So here's our primary trauma assessment. So your major injury is going to be a right arm amputation with a lot of blood being lost at that site, including arterial. The lower arm appears to be shredded. And when you're dealing with him, it appears that you had to use 2 tourniquets to get any sort of bleeding control. So it's pumping out hard. Now, if we look at this patient, he's awake, anxious, and confused, and here's your GCS score calculations. Airways open, so no action there. Rapid, shallow breathing with no adventitious sounds. Skin pale, cooling, clammy, and the heart rate is thready and rapid. And let's say that this continues when you get him into the warm ambulance, and this is not specifically because of weather. You initiate transport, you go ahead and do everything you can to heat him. You have 1 extra EMT that's riding along with you, and you've got somebody obviously driving. It's going to take a little bit longer, perhaps 2 hours and 25 minutes to get there with the roads being so icy in the middle of this winter storm. The assessment indicates that he's in shock, which are vital signs initially kind of identified. Blood is available in your protocol by special skills, and you've had training, and with your criteria, he meets the criteria for you to give blood. His GCS changes a bit as you're transporting and preparing to get things going. You've already started some basic things like getting an IV and making sure he's got oxygen. You've dealt with the bleeding as best you can. It's oozing out, but the arterial spurting has ceased because of the application of 2 of the tourniquets. His GCS is now 12, and his eyes open when you call his name and a light touch, but not necessarily a sternal rub. So you want to give him blood. So because this transport is significant and he's responding only appropriately when you touch him and not spontaneously, you inform him that with the lack of access, he needs blood to survive. And he certainly acknowledges that point while you're talking to him and then seems to rest his eyes for a bit. So he tells you, as he's processing the information, that he's a Jehovah's Witness and he cannot have blood according to his religion. You begin to explain that if he doesn't have the blood, he may very well die. So your goal is to try and get his blood pressure to increase with oxygenated hemoglobin. So by giving him the blood and decompensated shock, you're hoping to save his life. But you just started transport. You've got 2 hours to go here. You really have to do something more than just starting fluids on this patient if he's going to live. So after you evaluate this risk benefit, you identify that if you don't give him blood, he will die in your ambulance on the way to the hospital. Now, that's not going to solve all of his problems, right? He still needs surgery and so forth, but it would keep him alive while he got to the hospital. As you explain this to him, you try to ask him if he understands. He falls unconscious and becomes unresponsive. His shock progressively worsens, and he remains a 3 on GCS scoring for the rest of the ride. So, you have to make a decision here. No one else is going to make this decision for you. There isn't a lifeline to call. So your choices are simple. Give blood or don't give blood. Give blood by basically saying, I have implied consent. And you know our rule, right? Implied consent basically gives something that the average person would want. The average person would be happy about. Don't give blood. Implied consent for you means that he's a Jehovah's Witness and he can't get it, but he will certainly die. So what decision are you going to make? It's difficult, but you have no other choice. You either do something or you do not do something. So I want you to hold that decision in your mind. Did you give blood under implied consent rules because the average person would want it, and you haven't been able to talk to him since he went unconscious, so you can't confirm whether or not he wanted the blood or not after his initial statement? You tried to give him all the information he needed, but he was unconscious. Or do you not give blood and honor his initial request? Although he's unconscious, implied consent for you then means that you're just honoring the request you got before he went unconscious. But you know, without a doubt, he will die. Difficult decision. So if you allow the death process to continue, you'll likely think that it was you who let him die. Maybe now or later in life, it'll come up and impact you negatively. So let's say that for more qualification before you solidify your decision, let's say that criminally, you won't lose your license over this and you wouldn't be convicted of a crime in either outcome, whether you give blood or don't give blood. So what will you do right there, right then? You have to make an ethical decision. So let's look at our decisions. Now commit, stay with one, do not change your mind. So you give blood. You save his life and you ask questions later. You decide that, well, certainly saving him is probably better than dealing with the ramifications of this young guy dying. Somebody you know, by the way. Remember that part. So you decide to save his life, and then the hospital can sort out the rest of the stuff when he regains consciousness. He does survive once you give blood, and he survives surgery when you call back to the charge nurse. You saved Anthony's life, a person you know. You saved his life. Congratulations. Now let's look at the other opportunity. If you chose not to give blood, technically he did say no before he went unconscious, and you did explain to him what was required. He was awake at that point in time. You withhold the blood. During transport, he goes into cardiac arrest and never regains a pulse. Anthony is dead before you get to the hospital. The person you know is now dead. You don't feel like you did the right thing according to your beliefs. Now, with those two things in mind, you saved him or you killed him. And I say you killed him because that's what you're going to think about later in life. I'm just being honest, right? That's the thought process you're going to have. But more appropriately, we would probably say that he died from his accident, not because of you. But you think that you killed him later in life. He's somebody you know. You know his family. You know, not really well, but they know that you're the medic that cared for him. So let's move forward. Let me actually erase some of the stuff I started here and go back to our slide. So a few years later, well, maybe not a few months later, actually, you respond to a 38-year-old male threatening suicide. Call comes out as a 25 Charlie 2, and you're requested standby for PD. You stage a quarter-mile away at the local AUSUPS from the call. This is your jurisdiction, say mid-New Mexico, and it's about let's say it's a year later. PD to Rescue 14, go ahead. Cancel. He shot himself, 10-7. That's what the cop tells you. Canceled. All right. Going back to bed. A little while later, you have coffee with a friend. And your friend is a state police officer that was on the suicide call. And you never went to the call because they canceled you, and they were going to deal with it through OMI. So you're always interested in gory details, right? So you ask, hey, what happened on that suicide call when you canceled us? What was up with that? So the cop says, once we made entry, as soon as we opened the door and announced ourselves, he shot himself. His brains were all over the room, man. It was pretty gnarly and nasty. So, it was obvious. We just called OMI. Well, thanks for not asking me to come and clean up, brother. The cop tells you, your friend, check this out. I was working on some paperwork lately, and I have this to try and complete it. It's in my clipboard. And he shows you a note. I'll let you read the note. So when you read this note, it suddenly dawns on you that this is the guy that you knew. And the police officer actually doesn't know that you ran the call with him a while back. This is Anthony's writing. Now here, this is basically worse than hell in their belief system. So by reading this, you can extract that if this is the impact on his life and he's committed suicide, and it's purely because of what happened with him receiving blood during the accident, it has a lot of ramifications on it. So if you decided to give this person blood and he lived, did he live a good life? There are some ethical studies that go into this. This isn't just simply made out of thin air, although it's not a call I've ever run. But there is research ongoing that has shown that psychologically what happens to survivors of receiving blood against their will, that are of the Jehovah's Witness faith, they actually go into deep depression. They no longer can go to church anymore. Their families that are very, very strict in some of the sects of the religion, they're so strict that they have to basically treat you as though you're dead. You're dead to me, is how they treat some of the children that, or family members, maybe not just children, that have received blood and survived. And because of that, it's the equivalent for Jehovah's Witness of eating blood, which is a strict moral sin. Although they didn't eat blood, they had blood inserted into their IV, they cannot receive the blood of another human being. Their wish is generally to die. Now, some other sects of Jehovah's Witness have actually loosened up on this a little bit, but people have committed suicide. True story. People have committed suicide because they received blood in the hospital, were resuscitated, their life fell apart afterwards, and there's no way out for them. The officer didn't know you were the medic on the call. Anthony is dead. There's no criminal liability. Nobody seeks you out. You fall through the cracks, if you will. He's dead. Your life goes on. So was saving his life the right thing to do? Those are the ethical decisions, right? This case highlights how moral beliefs can clash. It's not a fantasy. Jehovah's Witnesses receive blood and their life afterwards in some sects of the religion are destroyed. So we have to identify, although this is not legal, illegal, so no illegal findings, it was not ethical. So when we do things like, I'll save his life now and ask questions later, certainly that's a thought process that paramedics, including myself, have had to deal with. However, if you know enough information about this person, we need to respect their beliefs, even if it means that they die. So let's look at ethical responsibilities for our patients. There's a few more terms that we have to explore here. The first term is going to be autonomy. Autonomy. This is where it all really starts for biomedical ethics. It's surrounding the individual's ability to make their own decisions. So in emergencies, we operate with little known information about patients, and even if we do know them, we don't sometimes know their belief system, right? At least not intimately. So we want to explore some of these different components because they all tie into consent that patients may make. So we have autonomy, primum non cara, beneficence, non-malfeasance, justice, rights, determining decision-making capacity, and paternalism. So at that's going to be the place that we take a brief pause, get yourself a stretch break, use the bathroom, have a cup of coffee. I know you're a paramedic student, you probably need some more caffeine. I dig it. Get your heart rate up by moving around the room, whatever it is. Take a short break and we're going to come back after this for part 2.